Good evening, everyone. Please, can I be heard? If you can kindly react to this so that I see if you can hear me. All right. So before we start, I want us to pray. So let us be in a mood of prayer. Heavenly Father, we thank you for bringing us here together today. We ask for your wisdom to guide our thoughts, your peace to keep our hearts aligned, and your grace to help us work in unity. Bless our discussions and decisions so that everything we do will bring glory to your name. In Jesus' name, I've prayed. Amen. Good evening, everyone. My name is Daniela Abena Anache. I'm a CTA FAMD student and the founder of Skincare by Dan. And I will be serving as the moderator for today's session. On behalf of the team, I would warmly welcome you and thank you for making time to join us today. So RTC Foundation is a health-focused NGO working to lighten the healthcare burden in Ghana and beyond. Through public health education, research, and impactful community projects. We are happy to host today's session as part of the RTC Health Dialogues, and this is just the episode 1. And this is a safe, open space where healthcare professionals connect with the public to share practical tips, answer questions, and discuss important health topics, all with one goal: fighting against miscommunication and helping people live healthier and happier lives. So today's discussion will focus on not every catarrh needs medicine, okay, and then self-medications and an abuse of antibiotics. And we have an excellent lineup of speakers here who would each take us through different but equally important aspects of this topic. So our discussion today is on a topic many of us already think we understand, catarrh. But as we've learned, not every case needs medication or medicine. Sometimes the best approach is simple self-care, and other times professional guidance is essential. So today we'll be looking at how self-medication and the misuse of antibiotics not only put our health at risk, but also contribute to the growing threat of antimicrobial resistance. So that's how today's session will go. Our first speaker will start by helping us understand what catarrh is and its management. And then our second speaker would guide us through self-medication and the abuse of antibiotics. Also, our last speaker will also talk about preventive measures we can all adapt. After all these presentations, we'll have a short Q&A session. So please feel free to jot down your questions as we go along, right? Without further delay, let's get started. So I'll start by introducing our first speaker. Our first speaker is Joyce Aframa Asamoah, a passionate antimicrobial resistance advocate and a fifth-year Doctor of Pharmacy student at the University of Health and Allied Sciences. She aspires to become a regulatory pharmacist with a strong interest in promoting medicine safety. And she is a committed Christian and a purpose-driven entrepreneur. She is also the co-founder of Josa Foods, a startup dedicated to providing affordable and nutritious food options to students. Today, Joyce will be taking us through understanding catarrh and its management. Joyce, please, the floor is yours. Please give her a number of reactions. I want to see the reactions to see that we are following.
Thank you so much, Daniela, for this lovely introduction. Thank you.
Welcome.
I'm waiting for you to share the slides.
Yes, please. I'm sharing the slides.
Okay.
So please, the floor is yours. You can start.
Yes, so as Daniela rightly said, I'll be taking us through what Catarrh is and how it can be managed. So, what is Catarrh? I'm sure we've all heard the term Catarrh before or even gotten it at one point. So, then what really is it? Catarrh is simply the buildup of thick mucus in areas like our nose, the throat, or the sinuses. And it's usually a protective response by the mucous membrane against infection, inflammation, or an irritation. And since this is a protective measure, catarrh is not classified as a disease by itself, but as a symptom of something else, like the infection or the allergy. And it can be temporary, like a short term, like when you catch a cold, or it can also be long term, as seen in allergies or when you have other sinus problems. What are the causes of catarrh? What can cause you to have a catarrh? We have numerous reasons. It can be infections, where it's caused by a virus, in the case of a common cold or a flu, and can also be caused by bacteria in a sinus infection or by fungi. And for fungi, this is usually less common. It's mostly seen in people that have a weakened immune system, like people with HIV or people undergoing chemotherapy or anything along those lines that will compromise your immune system. And also allergies. People can get catarrh from some allergies like pollen or dust or animal dander, usually from pets like cats or dogs, and sometimes even rodents at our homes. And these particles are so small and light that they can float in the air for a long time, and they can even stick to furniture and clothes. And once they get into your airways, they can cause an irritation and hence lead to catarrh. And also mold, and this is common in areas that are mostly moist. And also some environmental irritants like smoke. For smoke, whether it's from cigarettes or burning wood or pollution, it contains tiny particles and chemicals that can irritate the airway. And this is going to trigger the body's protective response to produce mucus. And over time, there will be an excess of mucus buildup, which is catarrh. And some perfumes. Some people use strong perfumes, and these perfumes can be irritating to others and hence cause catarrh. And even dry air and air conditioning as well can cause some people to have catarrh. And also some structural or medical issues like nasal polyps. Nasal polyps are like a mass, or let me see, a growth, a non-cancerous one, inside the nose or the sinus. And usually they are large. When they get large, they can block airflow, which will reduce your sense of smell and contribute to catarrh. And also deviated nasal septum. Your nasal septum is the wall that divides your nostrils into two. So a deviated one is basically a bent one, or one that is off center. And this structural difference in some people encourages mucus buildup, and this leads to catarrh. And also chronic sinusitis. This is basically long-term inflammation of the sinus. And also reflux related irritation. For reflux related irritation, this is where you have an acid reflux, or the backflow of acid from your GI into your airways, your larynx. And this will cause irritation there, leading to catarrh in some people. What then are the symptoms of catarrh? What are some of the things that you see that will let you know that you have a catarrh? There is persistent, blocked, or runny nose. And this is from the excess mucus buildup that will form in your nasal passages. And also postnasal drip. This is mucus dripping down the back of your throat. And often when this occurs, you will feel the need to want to clear up your throat. And because of that, there's also frequent throat clearing or cough. And this is most especially worse at night. And also feeling of mucus stuck in the throat and the loss of smell or taste. This can be either reduced or a total loss. And there's also the cough that I mentioned, which is frequent at night. And also chronic catarrh can also lead to irritability, poor sleep, and reduced concentration. And this is most especially seen in children because of how uncomfortable catarrh can be. So now let's debunk some myths concerning catarrh. People say that catarrh only happens when you catch a cold. And this is not true. We've gone through various other causes of catarrh, like the allergies, the pollution, the smoke, or even acid reflux. So it's not only just a symptom of cold. And also green or yellow mucus equals bacterial infection. This is not true, although in cases of a bacterial infection, you can have a green or a yellow mucus. It is not restricted to only bacterial infection. This can be seen in viral infections as well. And usually the mucus color changes due to the presence of immune cells, the white blood cells, the neutrophils specifically. They have a green pigment, and this causes the color of the mucus to also be green. So it just doesn't limit the cause of a green mucus to being from a bacteria. And also milk causes more mucus. This is anecdotal in a way. There's no scientific evidence that shows that milk will cause you to produce more mucus or even thicken up your mucus. The milk may feel some way in your mouth, but they have no direct scientific correlation to you producing more mucus or having a thicker mucus. And you need antibiotics to treat catarrh. As we have said, catarrh is not only caused by bacteria, it could be from a virus. So using antibiotics to treat them would be ineffective. So not every catarrh needs antibiotic treatment. How can we then manage catarrh when we get it? There's self-care. This is where you can do the steam inhalation. This will help to loosen up your mucus. And also staying hydrated. Drinking a lot of water will help to thin out your secretions, and it will help it come out easier. And also elevating your head while sleeping. This will reduce the postnasal drip that I spoke about, the mucus dripping down the back of your throat. Elevating your head while you sleep will help prevent this. And there's also medications. Using medications is dependent on the cause of the catarrh that you have. So if your catarrh is caused by an allergy, then antihistamines would work for you. And if you are looking for a short-term relief, decongestants can also work. However, long-term use of decongestants is not recommended because some of them can cause rebound congestion. And also when your catarrh is being caused by something else, the decongestants will just max out the underlying problem. And also using nasal corticosteroids. You can use these ones when your catarrh is being caused by an inflammation or a chronic condition. And using antibiotics. Antibiotics are limited to using them when your catarrh is being caused by a bacteria. So you only use antibiotics if it's confirmed that your catarrh is being caused by bacteria only. And also using PPIs. You use PPIs when your catarrh is being caused by an acid reflux. So omeprazole, pantoprazole, these ones will work only when you are having a reflux of acid causing your catarrh symptoms. So some prevention tips. What then can we do to prevent getting catarrh in the first place? You need to avoid smoking and secondhand smoking. Secondhand smoking is basically being in close proximity to somebody who is smoking. Even though you are not actively smoking, you are also inhaling the smoke. So that is secondhand smoking. We need to avoid that, and also avoid smoking as well. And also controlling your allergies. Once you realize that certain allergies like the dust or the pollen can cause you to have catarrh, then you try and avoid these things. And also staying away from known irritants like the strong scented perfumes. Once you know that these things can irritate your airways, then you try to avoid them. And treating underlying sinus problems promptly, and maintaining good hand hygiene to avoid frequent infections. All these things will help prevent you from getting the catarrh. Yes. Thank you so much. This is where I am.
Thank you so much, Joyce, for such a clear and insightful presentation. I've really learned a lot, and I'm sure our audience have also learned, like they've gotten some tips. I'll share what I've learned so far. What I learned was that catarrh shouldn't be treated with antibiotics, primarily because most of them are caused by viruses. Yes, so that's what I'm taking with me today. If you've learned anything from what our speaker has said today, please drop it in the chat box, okay? And we'll come back to it. So up next is our next speaker, Dr. Josephine Jankama Bediako. She is a pharmacist, a health educator, an advocate for safe drug use, mental wellness, and faith-driven healing. With years of experience in pharmacy practice and community outreach, she has seen firsthand the impact of misinformation, silence, and stigma, and is passionate about simplifying health education, promoting intentional living, and supporting holistic well-being. Today, she would be guiding us through the self-medication aspect of our discussion. Dr. Josephine, please, you may begin. I want to see the reactions. So if you are following us, please react to whatever we are doing today. Thank you.
Okay, thank you very much for the nice introduction, Darlena. So my name is Dr. Josephine, and I'll be presenting on self-medication and then abuse of antibiotics. So first of all, I would like to ask that have you ever self-medicated before? And if you have ever self-medicated, with what medication? And why did you decide to self-medicate instead of going to the hospital? That's my question. So I would love for people to unmute and tell us.
Please, can I answer?
Yes, please, you can.
I think I have. I've used some pain medications before. Yes.
Hey, somebody says a lot of times, hey, Dr. Loisha. Okay, please, any other? But please, why did you self-medicate? Daniela,
Yes, doctor.
why did you self-medicate?
Well, maybe because of what I know. I don't do it regularly, but it's once in a while. Like when as women, sometimes you have this cramps and stuff. So sometimes you have to, take some pain medications to help alleviate the symptoms. Yes. So that's the usual time I usually take these medications. I don't take it regularly.
Okay. Please, any other? As first aid. Okay. Okay. So please, what medication did you take for the first aid? And what condition did you diagnose yourself with? Mr. Kweku Kakrabwatin. Somebody said to avoid going to the hospital. Oh. But why? Why don't you want to go to the hospital? Mary. Please, I need answers. So I need answers. Mary, please, why don't you want to go to the hospital?
Okay, there is this fear that when you go to the hospital, they're even going to diagnose other illnesses. So to avoid that, you just take your medication, then you're good to go.
Wow. That's interesting. somebody said it was headache, and it was stress related, so they decided to take some more. Someone said they self-medicated for headache. I felt okay, that's fine. So it means that we all self-medicate. And the truth is we all have reasons for doing it. Very, very sweet, sweet reasons. But today I'm here to tell you that self-medication is not the solution. It may be something simple or slight to you, but never take your health for granted or allow your body to go through guesswork. No, you have to go to the hospital. Even if you can't go to the hospital, you have to talk to a healthcare professional before you take anything inside your body. So when we talk about self-medication, it's defined as taking drugs without a prescription or professional advice. And it's often the medications people normally self-medicate are over-the-counter medications and also leftover medications without proper diagnosis, and even prescription medications. It involves most medications. You taking medications without the knowledge of any healthcare professional. So number one, you self-diagnose yourself. You yourself, you decide to play doctor and you decide to diagnose yourself that, oh, maybe I have this infection. Then number two, you decide to give yourself medication. That is what self-medication is all about. So what are some of the factors and some of the potential risks? So with the factors, number one that we have here is limited access to healthcare services. But I think even from what you guys talked about, nobody had that issue. But for some places, maybe rural areas, it may they may not have healthcare close to them, and therefore it may cause them to self-medicate. Financial constraints or lack of health insurance, and this is so real because we have so many people complaining of economic burden, and because of that reason, when you tell someone to go to the hospital, they don't want to go, and it may be so severe. Someone may have like um how there's this teeth issue they call kaka, and you can see that the thing is about to fall. The person doesn't want to go to the hospital because of money. You keep on advising, oh, go to the hospital, the medication I'm giving you is going to just help reduce the symptoms, but they won't listen because they feel like they don't have money. But I keep telling them that all the money that you are using to buy all these other antibiotics and other painkillers, if you had gathered them, you would have been able to use it to go to the hospital. Another reason is perceived minor nature of the condition. Just as it was said, somebody said slight headache. But trust me, we all know that even headache is a very, very important symptom in a lot of conditions. The most common one is hypertension. So something that may be slight to you and you are connecting it to stress may not be what you are thinking. But then you think that, oh, it's just headache. You are perceiving that it's just a minor condition. Also, convenience and time saving. And this is what we have been doing. And we are trying to say, oh, it's first aid. Because you just want convenience and you want to save time to go to the hospital, you are calling what you are doing to yourself first aid. But even if it's first aid, you are still supposed to talk to a healthcare professional before you take it. Just because it's first aid doesn't mean that you just have to pop in some pills and then you are good to go. Just because you had diarrhea doesn't mean that you should just go to the first aid box and go and pump some flagyl. No, it doesn't work that way. Cultural beliefs or traditional practices, and this is so real. I mean, we are in Ghana, and I always say in Ghana, self-medication is like a cultural something. We always want to take medications because that's how, like, when we were growing up, that's how they brought us up. Even when my mother was not a nurse, when I was young, when I have small diarrhea, she'll give me flagyl. When my head was aching, she'll give me para. So you too, when you are growing up, you also want to continue with that culture. Also, some people have so many cultural beliefs about not going to the hospital. If you go to the hospital, they will give you, just as somebody was saying, they will make the thing worse. So many stories, all in the name to self-medicate, not just with even orthodox medications, but even herbal medications. Also, lack of awareness. And this is the key thing, because people don't know that medications are not candies and can actually be poison to you if you don't give the right dosage. these medications, they all have side effects. And if you don't take care, they are good when they are used right. But then if you do not use it right, it can damage you and destroy you. And it's because people don't know how damaging these medications are. That's why they think that they can just go in and then just be popping in some pills. So now let's talk about the potential risks. I mean, well, maybe a lot of healthcare professionals are here, but still, you can't play doctor when it comes to yourself because you are more likely to incorrectly self-diagnose yourself. And a lot of times you are thinking that, oh, it's just stomach ache. Oh, it's just headache. Oh, it's just cough. Oh, it's just something simple. But it may be something worse or something that if we can even treat it now, it wouldn't get to that worst stage. But because you just want to diagnose yourself and you do it, you may do it wrongly. You will say ulcer, but who knows? It might even become worse and become appendicitis. So the more likely you are to incorrectly self-diagnose yourself is very, very high, even if you are a healthcare professional. Inappropriate drug selection. So, oh, it's cough, but maybe maybe something worse. Maybe it's pneumonia, or maybe it's something else. Or maybe you will think that it's actually pneumonia, but it may not be pneumonia, it's something else. So you just go and pop some antibiotics just to feel better. By the time we get to know exactly what is wrong with you, it is not pneumonia and it is something else. All because you decided to just self-medicate and then give yourself medication. Also, incorrect dosage and duration of use. And this is so true. It will surprise you. Just Friday, no, it was Thursday. I was talking to some people about self-medication and I asked them the dosage of paracetamol and was surprised that some of them were surprised. You would think that, oh, it's just para, but people are more likely to give incorrect, like taking incorrect dosage and then duration. And the duration is very, very important, especially when it comes to antibiotics. Because you are self-medicating, you will just take it for 3 days and when you are feeling better, you will stop. That's where the problem is. We don't follow the duration. And sometimes it comes because if you don't know, I mean, when we are getting better, you just take it. But if you had come to the hospital or even come to the pharmacy, when I am giving it to you, I'm going to talk to you about it and explain and emphasize on it that you have to take it for 7 days. You have to take it for 3 days. You have to take it for 5 days. You have to take it for 14 days. So that whatever that is wrong with you can be cured and not come back. But if you decide to self-medicate, because you may not know, you are more likely to do it. Also, interactions with other medications and substances. I've already told you, medications, they are interesting. One medication and another medication combined together can cause so much that they are all good though, but some of them, they can't come together. But you may not know. There are some medications that can, when you even take it with some food or some juice, when they come together, trouble has come. So you can't just take medications anyhow. You have to be careful. Anytime you are taking medication, you have to be asking yourself a lot of questions before you take them. And another one, masking underlying health conditions. So maybe you may be coughing, then you just keep on pumping antibiotics because as for you, you would be telling people that when I'm amoxicillin, that's the only time my cough will go. Then you'll be coughing, you'll be taking it every month, you'll be coughing, you'll be taking it. By the time you go and check, it is something worse. Maybe you will take it, then you get better. But if you had gone to the hospital and not self-medicate, we could have gotten to know more through lab tests and see exactly what it was, instead of just taking medication to just lessen the symptoms. Now let's talk about abuse of antibiotics. When we say abuse of antibiotics, what do we mean? Number one, taking antibiotics for viral infections. And in Ghana, this is so hard because how will you convince a Ghanaian that, oh, you are having a cold or a catarrh? It's a viral infection, so you don't need antibiotics. They will tell you no. I've been taking amoxicillin and that's what works for me. And you're like, it doesn't make sense because if whatever that you are having, the symptom that you're having, you don't have anything that indicates that you have a bacterial infection, there's no way antibiotics are going to work for you, but they won't listen to you. Some of them will fight you, some of them will insult you, so many other things. It's so hard to convince people, but it doesn't make sense. Antibiotics can't work in a viral infection. Whatever that you are taking is just having a placebo effect. So just because you took it once and it worked for you doesn't mean that that's the solution to it. Number two, not completing the full course. And this is so true because me, anytime I'm giving it to my clients, I'm telling them 7 days, twice daily for 7 days. They'll always give me some smile. I know that in their hearts, they're like, hey, this woman, she knows me. But that's what we do. When we take antibiotics and we are getting better in 3 days' time, then we stop. And this is very bad. This is the reason why we are having most of our antibiotics not working as they should. And also using leftovers or someone else's medication. I always say when it comes to antibiotics, please, sharing is not caring. I beg, sharing is caring everywhere, but not when it comes to antibiotics. Don't take some and leave some. Okay, if you have left it, fine. But don't go and leave some and give it to someone else. Just this Sunday, I had a client who came looking for a particular brand of anti-malaria. So I was like, oh, we don't have this one, but we have this one, so take it. But she kept on insisting that she wants that brand. Now, I was like, why? And she said, oh, she has already taken 3 of the other one. And I said, how? Because anti-malaria, when we give it to you, it's a course. You don't take some and leave some. She said, oh, she stopped. And I said, but you know that you're not supposed to stop. Oh, she knows. And I'm like, we know, but still we will do the wrong thing. You will take it, then it will now come back again. Then when it comes back stronger. You do that same medication, it's not working. You're going to blame the medication and come and say the medications are fake. Meanwhile, it is you. You are the problem. So please, don't be taking leftover antibiotics. Don't take someone's medication. And don't say, oh, it's my friend gave it to my friend took it for this symptom, and then me too, I'm having the same symptom, so that I'll give it to the person. So many times people come, my pharmacist can be without prescription. We don't give antibiotics. We don't care. You can insult us. You can go and buy the medication and come and show us. We won't give it to you. And a lot of time when people come, it's always some family member suggested. My friend said, your friend too is not a doctor. Please, when it comes to antibiotics, we beg. Just because it works for person A doesn't mean that it can work for person B. Now let's move on to the consequences and the almighty antibiotic resistance. And it seems people don't really understand because the way antibiotic resistance is so deadly to us, if you knew it, you will never take antibiotics for granted and be popping it in like candies. I always say, nobody is somewhere bringing out any new antibiotics. Maybe that's what people are thinking that, oh, there are people in the labs bringing out new antibiotics. No. And even the ones that they are bringing, if they bring it, it will be so expensive that you can't even buy. Now, our antibiotics are not working because of how we have been abusing it. Mostly, these small infections, when you have them and you take the first line antibiotics, oh, it works like magic. But now you are going to use it and they are not working. You now move on to second line, they are not working. You now have to move to third line. When I went to Awogu, we were using vancomycin for infections. Something that's supposed to be third line. Now that's what we are using because of how we have been abusing antibiotics. I wanted to read a statistic so that we can understand how. So let me read a study that was done. It says that studies show extremely high resistance levels, 73 to 82%, to commonly misused antibiotics like tetracycline, ampicillin, cotrimazole, and then chloramphenicol. And we all know that all these medications, they are off the market. But trust me, I have worked in a pharmacy where they had all these medications and people were still abusing them.
Mm.
They will come, they will say, I want red and black. Me, I had worked in NS Chemist for a long time, like since I was an intern. So those things, I had never even seen them with my eyes before. But that place, I saw it and I was like, oh, wow. And they were selling it. People can they can't they and when even they buy, they don't buy a lot. Oh, they'll come and buy a few ones. Some of them will buy different colors, then they will go and mix it. They will mix with coconut. Some will mix with they have this name that some drink and then they will drink it. And the information that they got was that it gives you how do I okay, oh, sorry for those who are a more accommodating. And I was so sure, like, is this multivitamin? There was this woman. Hey, that woman, that was I was now starting fresh. So when she came, I was trying to explain to her. She told me that no matter what I say, she will give them the antibiotics. And then the other child was so the other one was sick, but the other one who was not sick was just saying, Miss Omenuma was a slain. Miss Omenuma was a slain. I see it was some juice or some. I was just shocked. Until you see it, when we are talking about it, you will think that people are just speaking, but it's real. We are abusing it, and it's causing so much issue. By the time you move to the second line, maybe your client or your patient might not make it. So please, antibiotic resistance is real. We can see that now infections are so hard to treat. These MRSA and all other ones, they are becoming so resistant. Like now, like the medications, they are not working as it used to. All because of what you are doing. And the ones that are coming, there's this one, the new one, I've forgotten it, it starts with P. It's so expensive for even one dose. And something that you could have treated for just 3 days or even 5 days. Now you have to do a long duration. And side effects. Side effects are I was using this story that when I was a child. I think the farmer this was what he was talking about. It was a long time ago. But I remember the picture that he showed us of a woman who had taken antibiotic and had gotten a rash, and it was like her skin was burnt. We have side effects like that. Like just because you are taking it and it's okay for you don't know. One day you might suffer from the side effects and you may not like it. And the whole point is that you may not even need the medication in the first place, but you think that you can just be popping it in because it's readily available to you. So please, let's reduce this misuse of antibiotics before you pop in anything, not just antibiotics, any medication. Always ask questions. Don't just stick it in because somebody suggested it. So now let's talk about some of the responsible safe medication use. Number one, always consult a healthcare professional. You are the reason why we went to school. You are the reason why we have to spend 6 years going up and down. So if you are taking medications and you don't consult us, then what are we doing? Please always seek medical advice from qualified healthcare professionals whenever possible, even if it's minor to you, even if it's just headache. Just give a call to your healthcare professional and just ask, okay, this is how I'm feeling. I want to take paracetamol. Any advice for me? And provide accurate information about self-medicated drugs to healthcare professionals, especially those who have chronic conditions. Something as simple as catarrh. Oh, maybe you are taking ciboefridine or phenylephrine. These things can actually cause your BP to go up. So when you go to your doctor, tell them, when I had catarrh, I took some decongestants. Tell them. Because these things, they have the tendency of increasing your BP. If you don't tell them, they will think that the medication is not working and they are going to increase it. So always tell them. Me, anytime somebody comes, I always ask them, have you taken any medication before coming here? Because typical Ghanaian, the moment something is happening, they will take something. Some of them will lie to you and say no. When you ask her, you realize that they took something before coming. So please, always ask, even if it's headache, please. Just because the more you say, you call them and keep on saying headache, eventually the person will tell you to maybe go and meet a specialist or go and do some tests. Also, adhere to recommended dosages and duration. If you say once, twice daily for 7 days, please do it. Don't take them when you are getting better for 3 days, you stop. We beg you. Please follow it. Anytime we tell you, do it for 3 maybe azithromycin, once daily for 3 days, then once daily to make sure you are doing this for every 24 hours. Time it. Follow the timing. If it's every 12 hours, you do it 8 a.m., 8 p.m. for 5 days, for 6 days. Don't miss it. I remember when there was this client, and it's something I always do. But then he said he came to work and then he had forgotten the medication. And then he remembered that I told him that he has to take the medication this way. So he came in to come and buy that extra to take it so that when he goes home, he can take the last dose. So follow it. I always say, maybe sometimes people think that we just talk a lot. But these things are backed by research. It's not like we just sat down and then we decided to be telling you that take it for 7 days, take it for 5 days. There is a reason. If you don't take it, they will not be able to kill the microorganism as they have been functioning to do. These microorganisms, some of them will die, but some of them will be left if you don't finish it. And the ones that are left, they'll come back stronger. So please, when we say 7 days, 5 days, please finish it for us. The next one is, okay, let me talk about the storage and then disposing medications. Okay, before that, let me talk about the recognizing situations that require professional medical attention. And this is very, very important because some of us, it will surprise you, somebody will bring someone. I had a client who said their child had a like high fever. And I was like, so you have left the child at home, walk to the pharmacy for what? Paracetamol. This is not a situation that this is the action that you should take. If somebody has a high fever or a severe pain, please go to the hospital. It's not everything that is pharmacy or anything that you just want to self-medicate. There are some things that you shouldn't play with it. The moment you see it, just go to the hospital to be treated. Having severe pain, high fever, or worsening of conditions, please don't stay in the house and be self-medicating. Go to the hospital. Also, storage and disposal of medications properly. Very, very important. If we tell you, keep it in a cool, dry place, please listen. I have had so many examples. People will come and buy a medication like Augmentin, which is so expensive. Then they'll come and tell you that, oh, where I kept it, heat has gotten to it and the drug has changed color. And they now have to come and buy another one. Some will say, oh, my daughter was playing and then it fell. And I'm like, how? Number one, we are wasting the medications. Number two, sometimes if you even allow some days to come, the person has to start all over again. So please keep the medications and if you have expired medication, expired antibiotics, now FDA has a list of all the pharmacies that you can come and dispose your medication to. The one I know is most NS Chemist branch, East Legon. We have a purple container. You can just come and dispose them there. The reason why we don't want you to go and dispose it in your bin is that someone might go and take it when you dispose it and use it to self-medicate. So please, let's dispose them well. If you have expired medication, just bring it. It's for free or you're not paying for anything. Just come and dispose it for us. And then the last one is monitoring for adverse reaction. And this is very true. The moment you see that you have an adverse reaction, the first thing is to stop taking the medication. Then number two, please go to the pharmacy and go and report. This report helps those who manufacture the medication. Because maybe in their reports, they are going to say, oh, maybe 1% of the area. But maybe if the more we record it, it will help them to make the drug better. Or maybe they will put it in their records that, oh, now this side effect has increased. So anytime you are taking it, you should be aware of it. So don't just, typical Ghanaians, when we have adverse effects, people don't care because after all, we won't give you money, but it will help those who are making the medication do it better. So this is the end of my presentation, and I hope that you have learned a lot from it. Thank you.
Thank you so much, Dr. Josephine, for breaking everything down so well. I want to see a round of reactions, please, because she has really explained and tackled the topic very well. What I took from here was antibiotics are for bacterial infections and not for viral ones. And then using antibiotics for viral infections is not only ineffective, it is going to contribute to antibiotic resistance, making future bacterial infections more harder to treat. Yes. So thank you so much once again, Dr. Josephine. Up next, we have Rejoice Ababio Boache, a general nurse and a beautician. She's also an entrepreneur who also offers training sessions for aspiring beauticians. She brings both healthcare expertise and beauty industry experience, and today she'll be guiding us on the preventive measures. Rejoice, please, you may proceed. Thank you.
Thank you, Miss Daniela. Good evening once again, everyone. As my name was mentioned, I'm the person of Rejoice Abebio Boache, and I'm taking you through the preventive measures. One, I'll start with the public awareness campaign. The public awareness campaign is by using the social media handles to spread health awareness, as we are doing. We are using the social media to spread health awareness, like as we are using the Zoom, the YouTube, we also use TikTok and Instagram to also spread the health awareness. And we also have improving healthcare accessibility and affordability. In this case, you see, in our rural areas, healthcare is supposed to be accessible and affordable for everyone. But in rural areas, since there is inadequate infrastructure and equipment to render quality care for them, the individuals out there falsely depend on the over-the-counter drugs medication for their relief. Because if they go to the facility, since they don't have enough equipment to care for them, they will just go to the over-the-counter medication drug or pharmacies to go and buy drugs to take and to relieve their symptoms. But meanwhile, maybe what the person will be digesting will be like, maybe I have headache, I have malaria. It not be so, it may be a different condition. But since they don't have the equipment to do diagnostic tests and labs, they will just go to the pharmacy, buy drugs, and at the end, they will have some effects and consequences. And also, under the improving healthcare accessibility and affordability, the healthcare is health insurance is an issue because I'm in the health system and I know how the our consumers out there are complaining about health insurance. Because you see, I remember I had some encounter with a patient. The patient was supposed to go and pay some bills. The patient told me that I have insurance. And I told the person that it's not everything that the insurance is covering. Then the person was like, so why are we using the insurance? Then we should stop using it so that I will know that as I'm coming to the hospital, I'm coming to pay money rather than I'll have insurance and pay huge amounts of money. So if our insurance scheme system expand their coverage, it will help the public out there to seek medical attention at the hospital rather than going to the over-the-counter medications and pharmacies to search for their relief. And also enhancing health literacy and patient education. As we are doing education to the public. We are educating on our health, how we will stay healthy, and how we will use our medications and antibiotics wisely and properly. And also, we have strengthening regulatory framework. Hereby, you see, May's Dr. Josephine said she knows one pharmacist that they are selling abandoned drugs that is not supposed to be sold, like the tetracycline, the coin, and other stuff. So if the drug board bring out strict guidance and penalties that if we see that you are selling drugs that are not supposed to be sold, they have to be punished. This will help us because our consumers are being put into danger. You see, the person will be out there. She doesn't know anything, he or she doesn't know anything about what she's taking. Then the person will go and buy it and take it. But the person don't know the harm that he or she is bringing to his or her body. So if there is a strict guidance and penalty on our medication that if you see that you are selling some drugs that is supposed to have a prescription and there's no prescription you are selling it, they should be strictly be punished. And so that it's help us to protect our consumers outside getting. If you open your TV station, your radio, YouTube, TikTok, you see that people will be advertising, if you buy this, it will cure this your disease. Then the person will go and buy, since the person see those doing the advert, their voice are too sweet, like they will convince you so easily. So first, if information that is to be bring out, it should be validated. Information that the advertiser or the marketer is going outside is validated so that their health can be protected. So, Miss Daniela, please can you move to the next slide? Okay, so the role of health professionals. We, the health professionals, what are our roles? One is accurate diagnosis. The health police, you see, sometimes when a patient comes to the hospital, we ask them, we first take their medical history. We ask them what causes the catarrh. The person will tell you, oh, I was sitting over at the overcrowded place and someone was having a strong perfume scent. So through that, we got to know that, okay. Then after that, if you take the medical history, you know that okay, let's go and do this person catarrh that he or she is talking about is a viral or bacteria. Then we take either throat swab to go and detect whether the person catarrh is a viral or bacteria infection. We also do prescription guidance. That's we guide our consumers, our public on medication. As we are doing, we are guiding ourselves. Okay. So we are educating ourselves on the antibiotic use, and we also ensure that they use the medication properly, the usage. Maybe if you are to take paracetamol 1 gram, you are taking it. If you are taking doxycycline once daily, you are taking it. Sometimes you tell the person that due to your headache, you have to take two, like 1 gram. The person will be like, I have severe headache, so why don't I take 2 gram? And you'll be like, wow, 2 grams. So why are you taking 2 grams? The severe headache, yes, you are taking 1 gram because of the severe headache, but combining four, no, it's no good. I've seen someone doing that. I was like, why are you doing that? The person was like, I have severe headache. I was like, no, we know the reason why we gave you the 1 gram. So stick to that. Sometimes some patients are too controversial. You put their drugs at their bedside. You tend, maybe you have given them the 1 gram. By the time you come back, you see that the paracetamol is reducing, but you know that it has to remain this. Then you come, it's few. You ask the person will be like, I was having severe headache, so I took additional one. You see, sometimes they are controversial. They put us in so many issues. You see. So as you're doing, we educate them. The next point is education on antibiotic use. So we inform patients about responsible antibiotics use and potential risks. As we are doing, we are educating ourselves on antibiotic use, the side effects, and the risks that if we do that, we will get. And the last point is promoting prevention. This is whereby we educate the consumers or the public on preventive measures such as good hygiene and lifestyle changes, to reduce the risk of catarrh and other illness. So I'll move on to the key takeaway. This next slide. So one, we got to know that not every catarrh needs medicine. Yeah, it's not every catarrh that needs medicine. Some are viral, unless it's confirmed that it's bacteria. And also got to know that self-medication can be harmful. Yes, it can be harmful to your kidney, your liver, or any other organs in your body. So we should know that self-medication can be harmful. And also responsible antibiotic use is crucial. Yes, sorry, if you don't want to know how to use antibiotic wisely, you put yourself at risk. So let's get to know the responsible antibiotic use. And also prevention is key. Yes, your hand washing, your good hygiene, your lifestyle changes is a key. If you go out and if you are coming from overcrowded place, at least please if you get home, do to wash your hands very well. And if better if you get you take your bath so that you clear any infection that you took from outside away. Okay. So let's go on to call to action. Okay, so call to action. one, consult a healthcare professional before taking antibiotic. Yes, you have to consult a healthcare professional because the drug that you're going to take, you don't know. You go to the pharmacy, you go and take it. That was last week. I was at night shift and a patient came. The patient is having HPT, sorry, hypertension. The patient came and there was hip care, and he was like, what are you doing with hip care? Hypertension does not go with hip care. And the person was like, I was going to buy Mister, and then the person gave me hip care. You see, sometimes our pharmacists can make a mistake. We are humans, we can make errors. So if you don't consult a healthcare professional before going out to go and buy a drug, you go and buy a different drug and it will harm you. So use antibiotic responsibly. Yes, you should use it responsibly. You should know when to use antibiotic and when not to use it. Also, practice good assurance. Whatever that you do, you should wash it, especially when you go out and you're coming home. You should try to wash it down and also do proper food hygiene. Spread awareness about responsible health practices. As we are doing that. We are spreading awareness to the public, to the consumers, for them to know their health very, very well. I will end here and thank you very much for your time.
Thank you so much, Rejoice, for this beautiful presentation. I've learned so much from this. I've gotten a lot of practical and helpful tips too, and I'm sure most of us here have also learned a lot. All right. So we've come to the Q&A session. If you have any question, please feel free to raise your hand, or you can type your question in the chat, or better still, you can unmute and speak when you are called upon. You can also direct your question to any speaker you want to answer the question for you. Thank you. So please, if you have any questions, you can ask. Are there any questions? All right. I think there are no questions for now. But then I think I'll just summarize what we discussed here today. So the key takeaways from the meeting: not every catarrh needs medicine. Self-medication can be harmful. And then you have to use your antibiotics responsibly. You also have to practice good hygiene. All right. Yes. Okay. Bene has a question. Dr. Benedicta has a question. Sorry.
All right. Hello, everyone. I hope you can hear me.
Yes, please.
All right. Thank you so much, Daniela, and thank you so much, Joyce, Rejoice, and Dr. Josephine. I was learning so much from your presentations, and I think that you all have done well. It's very commendable. Dr. Josephine, I have a question for you. I want to ask a question as a layman. I mean, as a person who is not a health professional. Regarding our health system, if you are in Ghana, the hospital setting, you would know how difficult it is for you to come to the hospital and eventually see a doctor. Some people come as early as 5 a.m. and then they end up seeing the doctor around 3 p.m., meaning that they wait for a long time. And that's why you see a lot of people, shining away from coming to the hospital. Regarding this, how far or I think that's one of the main reasons why people self-medicate.
Hello, Bene.
Hello. Okay, so my question is, how far is too far and how far can they go? Someone mentioned the issue of first aids. So if, let's say, a person is at home and having, let's say, some minor symptoms like, let's say, headache or let's say cramps, are they absolutely not allowed to take any medications, or can they take something before they seek help? Sometimes there are some medications that they'll say that um, after take it for 3 days. If after 3 days you don't see any improvement, consult your physician or consult your doctor. So how far is too far in the regulations of antimicrobial resistance and their regulation, antibiotic stewardship, and even with self-medication, how far is too far and how far can the patients go? Thank you.
Okay, thank you very much for the question. So when it comes to antibiotics, I don't recommend and self-medicate with antibiotics, no matter what. If they are over-the-counter medications, the recommendation that we are giving is that before you take medications, you should at least let a healthcare professional be aware. So by now, you should be looking for a healthcare professional that you can keep on your phone and pick your phone and ask them, even if it's just paracetamol, medicate. So now that guesswork of just taking medications, this one we are not doing no. If you're medicated and you're in the house, just call your healthcare professional. You don't even have to go to the hospital. The key thing is that you have to talk to a healthcare professional first. Don't take medications without making them aware. Always make sure that you are talking to a healthcare professional. If it's someone at church, have their contact. So you want to take this medication, just give them a call and let them know. It may be a simple headache. You have taken one dose. You have gotten relief, but do your best. Call a healthcare professional. The reason why we went to school is because of you. So you shouldn't take medications without our knowledge. Do your best to talk to them. If you talk to the right people, at least if the person has that information that, oh, you have taken one dose and for 3 days you have been taking paracetamol for a certain headache, they can give you the best advice. But if you keep taking it, you are okay. Another time you have headache, you keep on taking it. Another time you continue to take it. Then maybe one day you just tell the person that, oh, today I'm having headache and I'm taking it. The person may not have that um past information to be able to give you the right or the next move. So before you self-medicate, talk to a healthcare professional. I know it's just headache because there are so many cases of self-medication that has cost us so much. So now we are just like, no, no, no to self-medication. If you want to take medication, even if it's para, do your best to talk to a healthcare professional about it. Even if it's first aid, do your best to talk to a healthcare professional just before you take it, so that they know what you are taking, they know what you are doing, and in case you have to self-medicate again, at least when they have that information, it helps them better to give you better advice. So it's just keep them in, like, let them know about it before you take the medication. I don't know if I've been able to answer your question.
I think you have. Thank you so much. So, those of us listening, it means that you have to get someone who is a health professional, a nurse, a pharmacist, a doctor as a friend, so that when you have a problem, you just go into their DMs. We'll talk about it another time. So, thank you so much, Dr. Josephine.
Welcome.
Emmanuel, please can you unmute yourself so that you ask your question? Sorry. I think he can't hear me, so please can you type it in the chat box? Dr. Josephine would address it, or any of our speakers will address the question. Thank you. So we have our founder, Dr. Benedicta, here with us. Want to invite her to share a few words. After that, we'll take a short prayer, and then we'll close the meeting. Thank you.
All right, thank you so much, Daniela, and thank you to all the speakers. And I'm sure we've all heard the speakers as they spoke passionately about this particular topic, the issue of self-medication and antibiotic resistance. Can someone please? Okay. The issue of self-medication and antibiotic resistance. You see that they are passionately talking about it because it's now a problem. And this is a problem that we don't usually see it outside. It's only the people in the hospital who complain about it. It's because when you bring your father, your mother to the hospital, you just give us a responsibility to take care of them. And then we struggle with what medications we should give them so that they become well. And as you are hearing from us, many of our medications are not working. And the reasons why the medications are not working is because a lot of us abuse them. So now the germs, I would say, which causes the diseases are now wise. Because we've been abusing them now, they've built something called resistance to them. And so we give the medications, and now they have built more muscles. We are not able to kill them. And so each time you are not feeling well and you want to take a medication, you want to take a pill, you want to take a drug, please think about it. If you are not a doctor, if you are not a health professional, you are not too sure what you are taking, please consult someone so that you do not harm yourself, you do not harm our nation, you do not harm the world at large, because now scientists are looking for more ways to create more drugs because the drugs we have in our system is not working. And so even though the topic was not catarrh, not every catarrh needs medicine. The whole point or the idea is that our medications are not working. So please, before you take medications for any minor illness or any minor disease, please pause and ask a health professional, else you are putting all of us at risk. And I think that our speakers have done marvelously well explaining all of these to us. And so we thank them so much. God bless you. And Daniela, God bless you as well. This is RTC Foundation, and I'm Benedicta Hayford. Thank you.
Thank you so much, Dr. Benedicta, for the opportunity to be here today to share what you know about this topic. And a very big thank you to our speakers for their time and expertise. And thank you to our participants for your attention and engagement. So we've come to the close of the meeting, and I would like to pray for the meeting to end. Father, we thank you for today's meeting, for the knowledge shared and the connections built. We pray for wisdom to put into practice what we've learned today, and for your guidance in our future endeavors. We pray that you continue to bless RTC Foundation and the founder, Dr. Benedicta, and all the speakers who came here today to speak to us. Pray that, Lord, you continue to enrich them with wisdom and understanding, to continue to guide the public on what to do. Bless everyone here and keep us safe until we meet again. In Jesus' name I pray. Amen.
Amen.
Okay. I think there's a question in the chat box. Should we address it before we end, or? I just saw the question. So I think, Dr. Josephine, if you can answer this question before we leave. Yes. So the person is asking that as pharmacists, doctors, and medical professionals, what can we do to address the issue of self-medication in the senior high schools? I've seen instances where parents pack medicine and tablets in bulk for their children at school so that they can take it when they are sick.
Okay, so what I would say to this is that the problem is not the availability of the medication. And mostly, I think they are over-the-counter medications for cold and those things. But the real problem is that they taking it without a healthcare professional's advice. So you may keep it, but before you swallow it, go to a healthcare professional. So you are in an SHS, they always have a clinic. Go to that nurse, because mostly they are nurses or doctor, and go and explain what is happening to them and tell them that, oh, these are the medications I have available. So this is the condition I have. What can I take? Then a person may advise, oh, if you have paracetamol, you can take. Even when people come to our pharmacy, we ask them, maybe malaria, you ask them, oh, do you have some, maybe you have headache, do you have some paracetamol at home? They will tell you yes. Do you have some vitamin C at home? They will tell you yes. Okay, then now start taking your vitamin C. So the issue is not them having the medication, unless maybe antibiotics, but even that, but you're not supposed to have it in your chalkboards, or opioid medication, you're not supposed to have it in your chalkboard. But I'm looking at the over-the-counter medications. Those are the one I'm considering. So you having it is not a problem, but you taking it without the knowledge of a healthcare professional, that's where the problem is. So if the person has it, you still need to advise the person that please make sure that before you take any medication, you let your healthcare professional be aware of it before you take these medications. So that would be my answer to that. That they having it is not a problem, but making sure that before they take it, they should talk to a healthcare professional before they swallow any medication. I hope I've been able to answer the question.
Yes, thank you so much for your insights. So I would entreat everyone to follow RTC Foundation on LinkedIn, or if you learned anything today, you can share what you've learned. As our nurse mentioned, we should use our social media to educate the public on these topics. So you can, whatever you've learned here today, you can share it and tag RTC Foundation on LinkedIn. If you're on LinkedIn, you can share it. Even if you are not on LinkedIn, you can just post it on your WhatsApp status, what you've learned today, so that those who are not able to join would get something from what's happened here today. So thank you all so much for your attention and your engagement. We look forward to seeing you at our next meeting. Until then, stay well and have a great evening. Have a good night, everyone. Bye.